As COVID-19 coronavirus infection continues to spread around the country, data has shown that population density may affect case and death rates. Often, higher density areas have higher per capita case rates, as people live, work, and play in closer proximity to each other. Because the virus SARS-CoV-2 is transmitted through droplets, proximity to other individuals is one of the risk factors. So in places where it is harder to practice social distancing, like densely populated urban areas, we often see higher cases per capita. At the same time, there are some states where rural communities are actually the ones experiencing disproportionate infection rates, often because of local outbreaks and exacerbating underlying conditions. As we can see here, the highest cases per 100,000 people occur in large central metro areas, but we also see the third highest case rate in non-metro or rural areas. The different case rates here show that it is not only urban areas experiencing high infection rates. We also see big regional differences in case rates between the West, South, Northeast, and Midwest regions of the US. Even though the Northeast was the original major national hotspot, the current case rate is actually very low compared to the rest of the country, with the southern part of the country now experiencing very high case rates. Looking at county comparisons on the COVID-19 Health Equity Dashboard, we can find some clear visual representations of COVID-19 case rates in different population density areas. To start visualizing, click on the tab Map Your State. By selecting a state and next selecting cases under COVID outcomes, and finally selecting population density in county population characteristics, you can map side by side these relationships in a state of your choosing. We can see a relationship where higher density areas have higher COVID-19 case rates in Illinois, Maine, Michigan, Nebraska, Nevada, New Hampshire, New Jersey, New York, Pennsylvania, Tennessee, and Wisconsin. But we see the opposite effect where areas with lower population density have higher case rates in Alabama, Georgia, and Kansas. And then there are states like Colorado, where the case rate is more mixed between both highly urban and very rural areas. Take a look for yourself at these maps and see the relationships you can visualize between COVID-19 and population density.